Hey everyone, welcome back. This is Mike. Today we're going to focus on how a transactional analyst might treat OCD. So if a person is practicing transactional analysis, a TA therapist would approach OCD, Obsessive-Compulsive Disorder, by examining the client's internal psychological structures, the ego states, the unconscious life script they are following, the games they might be playing, and the injunctions and drivers that influence their behaviors. The goal is to help the client achieve autonomy, which means living in awareness, spontaneity, and intimacy, free from the constraints of past programming. So here's a breakdown of how a TA therapist might treat OCD. So core TA concepts applied to OCD. Ego states, the parent, adult, and child. The parent ego state. This contains internalized messages, rules, and attitudes from authority figures, parents, teachers, etc. In OCD, a critical or demanding parent ego state might be highly active, manifesting as a critical parent, generating obsessive thoughts, you must be perfect, you're dirty, something bad will happen if you don't do this. This often sounds like internalized criticism, blame, and moralistic demands. The nurturing parent, sometimes the over-nurturing or controlling. While seemingly supportive, it can also manifest as excessive anxiety about safety or an overprotective stance that reinforces compulsions. The child ego state. This contains emotions, feelings, and behaviors from childhood experiences. The adapted child. The part that complies with or rebels against parental messages. In OCD, the adapted child might be trying to appease the critical parent by performing compulsions, feeling anxious, fearful, or ashamed if the rituals are not followed. It's often the part that feels overwhelmed by the fear and dread. The natural or free child. This state is associated with spontaneity, creativity, and joy. In OCD, the free child is often suppressed or stifled by the demands of the parent and the anxiety of the adapted child. The adult ego state. This is the rational, logical, and reality testing part of the personality. It processes information objectively without contamination from the parent or child. In OCD, the adult ego state is often contaminated by messages from the parent or fear from the child, leading to distorted reality testing where the individual genuinely believes their compulsions are necessary to prevent disaster. 2. Life script. This is an unconscious life plan decided in childhood, reinforced by parents, and justified by subsequent events, and culminating in a chosen payoff. For an OCD client, the script might involve themes of, I must be perfect to be loved or safe. I am fundamentally flawed or dirty. I must control everything to prevent catastrophe. I am responsible for preventing harm. The rituals become a way of sticking to the script, even if it's painful. Injunctions and drivers. These are powerful, often nonverbal messages received in childhood that contribute to the life script and drive compulsive behaviors. Injunctions, these don't messages. Don't be who you are, don't be close, don't feel, don't be sane, don't exist. For example, a don't be close injunction might manifest as a fear of contamination preventing intimacy. Or don't be sane could relate to the irrationality of obsessions. Drivers, these are be messages. For example, be perfect, hurry up, be strong, please others, try hard. The be perfect driver is highly relevant to OCD, fueling the need for flawlessness and ritualistic behavior. Be strong might contribute to suppressing vulnerability or asking for help, while hurry up could relate to the urgency felt to complete compulsions. 4. Games people play. These are repetitive, predictable patterns of communication with an ulterior motive and a payoff. Payoff being a negative feeling that reinforces the script. While not always obvious, some OCD behaviors could be framed as a game if they elicit specific reactions from others. For example, getting others to reassure them, which ultimately reinforces the cycle. A common game related to anxiety could be, if it weren't for you, for example, if it weren't for you or for this OCD, I could be living my life. Treatment approach. A TA therapist would utilize the following to treat OCD. Decontamination of the adult ego state. Help the client differentiate between thoughts originating from their parent, the rules, judgments, etc., their child, feelings, old experiences, and adult, objective reality. Challenge the irrational beliefs and fears associated with OCD by helping the client use their adult to assess the true risk and consequences. What is the actual factual evidence for this fear? Is this a rule you learned or a rational assessment? Uncovering the life script. Explore the client's early childhood experiences, family messages, verbal and nonverbal, and decisions they made about themselves and the world. Identify how the OCD symptoms fit into their overall life script and what purposes they serve. For example, a way to feel safe, to prove worth, to avoid intimacy. Analyzing transactions. Examine how the client interacts with others, especially when their OCD is triggered. Are they seeking reassurances, child-to-parent transaction? Are others reinforcing the rituals, parent-to-child transaction? Help the client learn to engage in more adult-to-adult transactions, promoting healthier communication and problem solving. Challenging injunctions and drivers. Helping the client become aware of the powerful don't messages and driver behaviors that fuel their OCD. Provide permissions to counteract the injunctions. You can be close. You can make mistakes. You can trust your own judgment. Help the client develop potency, the ability to act on these permissions. And protection, the therapist's role in creating a safe space for change. Redecision and reparenting. The core of TA therapy So again, this is the redecision reparenting is the core of TA therapy to help the client make a conscious redecision about their life script. This involves going back to the original childhood decision, often made by the adapted child, and making a new, more autonomous choice from the adult ego state. The therapist provides a corrective reparenting experience, often offering permission and protection that the client may have lacked in childhood, helping them develop a healthier internal parent. Deconfusing the child ego state. Help the client acknowledge and address the underlying fears, anxieties, and needs of their child ego state that are being expressed through the OCD. Encourage the expression of authentic feelings, natural child, rather than merely acting out patterns, old patterns, the adapted child, and moving towards autonomy. The ultimate goal is for the client to gain autonomy, freedom from the compulsion of their script, the limitations of their ego states, and the need to play psychological games. This involves moving toward awareness, knowing what's happening internally and externally, spontaneity, acting freely and authentically, and intimacy, engaging in genuine open relationships. Example application. For someone with contamination OCD, the parent would be saying, "You're dirty, unclean, you must always wash." That's the critical parent message. The child feels overwhelming anxiety and disgust. Adapted child fear, leading to compulsive washing to reduce distress. Adapted child compliance. Adult becomes contaminated by the parent and the child, believing the hand washing is a rational necessity. Script, I must be perfectly clean to be acceptable or safe. Injunctions, drivers, don't be dirty, be perfect. A TA therapist would work to help the adult identify and challenge the irrationality of the parent's demands and the child's fear. Uncover when and why the client internalized these messages, the life script. Offer permission to be imperfect, to be human, and to tolerate uncertainty. And support the client in taking small steps to reduce compulsions, validating their courage. Reparenting. So the effectiveness. While TA offers a comprehensive framework for understanding personality and interpersonal dynamics, it is not a primary empirically validated treatment for OCD in the same way that cognitive behavioral therapy with exposure and response prevention is. TA focuses more on personality restructuring and understanding the why behind the behavior. However, its emphasis on conscious awareness of ego states, challenging maladaptive life scripts, and promoting autonomy can be a powerful complementary approach for individuals who want a deeper, more holistic understanding of their OCD in the context of their life story. Some TA therapists might integrate elements of behavioral techniques, but the core focus would remain on the psychological underpinnings. So what do you think about TA and how it approaches OCD, and would you want to be treated this way? Let me know in the comments, and I'll speak to you next time.